Hi there, everybody. So we look very calm, cool, and collected, but we had a little bit of a change that happened very quickly. And you can see that Dr. Palazzo is not on the stage, but Chelene is. And so thank you very much, Chelene, for stepping up and helping us get back on track. I'll start with that. My name is Dara Smith, and I'm the Regional Director here in the Pacific Northwest for HMA, Health Management Associates. We, like the State of Reform Company, that is our sister company, bridge the gap between healthcare and the policy that governs it, connecting policy and practice. Today, we're here to talk about challenges in the healthcare industry in Washington State. And we have 45 minutes. We could probably talk for 45 hours about that topic, but we're going to limit it to 45 minutes today. And what better way to do that than to bring together two leaders of two important organizations here in Seattle, Premera Blue Cross, and now we have the Washington State Hospital Association to represent the provider perspective. The healthcare industry is facing rising costs, workforce shortages, fragmented systems, and inconsistent patient outcomes, all while demand for care continues to grow. Advancing the industry will require coordinated policy reform, greater interoperability, sustained investment in workforce and technology, and a stronger focus on value-based, patient-centered care. Last night, a group of us got together, and this morning, on our first panel, we were talking about the importance of working together and collaborating as we're facing all the challenges that we're facing right now in the healthcare industry. So I'd like to talk with these two leaders about how they're going to be working together collaboratively. I'm going to ask each of them to briefly introduce themselves and share one thought on how you're thinking about the state of Washington's healthcare system right now. Jeff?
Well, thank you, Dara, and good afternoon, everybody. Thanks for being here. A meeting like this gives me both energy and hope that we have so many here committed to our state's healthcare system, and to making it better is really encouraging. So it's great to spend some time with you today. I'm Jeff Rowe, President and CEO of Premera Blue Cross, where I've been for 27 years. I'm a native of the state, grew up, I'm a Husky, and have raised my family here. I have two daughters that live in the state and one that's out of state for the time being. It's also Premera's home. It's been our home for 90 years in the state. So this is not just a place where I live, but where we obviously work and hire from. So this is a really important place for me personally, and obviously for my company. And so we care deeply about the welfare of the state and the direction of the state, and are working very hard to improve both, frankly. Premera is the only commercial health plan that's domiciled in the state of Washington. We've, in the last 5 years, donated more than $100 million to various efforts to improve our healthcare system, whether it's in behavioral health or workforce development, clinical integration, homelessness, and so forth. So this matters to us deeply. With regard to how I think about the state of the healthcare system in Washington right now, I kind of have two schools of thoughts on that. On one hand, I think we're potentially entering a golden age. I say that because there's so much promise that's out there now as a result of technology in particular. When you look at the benefits that AI could bring, you'd see in my business enormous administrative improvements, efficiencies of maybe 25%. You'd see through better access, through better data, through just better application of technology, lower healthcare costs that could be 5 to 10% lower. And I know we're talking a lot about affordability here, so that matters a great deal. You also see the potential for enormous new cures. I think drug development will is accelerating rapidly. I heard the leader of DeepMind, which is Google's AI arm, say he didn't think there would be disease in 10 years. So there's a lot of promise there, and I'm a natural optimist, so I kind of go there and I think, well, that's cool. I'd love to see all that stuff come to reality. But I'm also a realist, and I have to say the second school of thought I have on that front is that we're either in the midst of or there is a storm gathering on the horizon, and we have to be realistic about that. There's a lot that ails our system right now, and the biggest thing is probably affordability. The fact is, healthcare is economically unattainable for a large segment of our society. And even for those that can afford, I put that in quotes, afford healthcare, it's stressing them immensely. You know, we're as a country paying 2x what other peer nations pay. We're seeing this materialize in very tangible ways for people. This is not an abstract concept. You know, 40% of people delay care. You got 30% of people who will forego prescriptions or cut pills. So there's just a reality that we need to deal with that. So I think both of those schools of thoughts can be true at the same time. We need to embrace the first and hopefully mitigate the second.
Chelene?
Great. I'm Chelene Whiteaker. I'm the Senior Vice President of Government Affairs at the Washington State Hospital Association. I have been with the Hospital Association for about 20 years now, which I kind of can't believe it some days. And I got my start in healthcare working on our state's mental health parity law. I have a brother who lives with a serious mental illness, and it was something that really brought me into healthcare, like many of us in the room, the mission side of caring for people and working on policies that make a difference in people's lives every day. I think we can, most of us or all of us would agree on that as a goal. So I also, too, am a native of Washington State and have spent my childhood and career here. I would say that I did not plan to be on this panel today. I'm a poor substitute for Dr. Palazzo. He's in my thoughts, and today his father passed away, and so he was actually here at the conference and had to leave. So keep him and his family in your thoughts. And also, I would have picked different socks this morning. I thought, no one's going to see my socks. I don't need to worry about that, as I ran out the door and tried to get my children to school before I drove here. So anyways.
And we both looked at our socks to make sure they were okay.
Yeah, you guys are fine. So in terms of when I think about what is happening in healthcare today, I appreciate Jeff's optimism. I do think there's a lot of really important and thinking about the drugs that are available now to people that are life-changing, to the technology through, the telemedicine transformations that we saw during the pandemic. But when I think of a word that describes where we're at, I would say crossroads. So we've got a situation here, as Jeff alluded to, where we've got rising costs of being able to provide care. It costs more money today for hospitals to do the same care that they delivered 5 years ago. And that's for a variety of reasons. And that is challenging. It's challenging for the hospitals. It's challenging for the payers. We don't deny that. And yet there's major forces that are pushing there in terms of 60% of hospitals, in terms of the cost, are labor. So when we think about, there's a lot of conversations about how are hospitals reducing their costs. Well, you've got supplies, you've got equipment, and you've got labor. None of those are necessarily ones that we set the price for. If you think about the labor market, that's a national market. You ask folks around the room, do you want nurses to get a raise? Almost, everyone's hands would go up. That all impacts affordability. I think the other piece that is the storm cloud is HR 1. We're very concerned about people losing access to coverage in Medicaid. That is something that I think also provides a lot of opportunity. We can work together. We can keep people on the rolls of Medicaid. We can work through those work requirements in terms of ensuring people can complete those. But that is going to be a challenge for us. And I think we also can come together and work together around having that goal of keeping people covered.
So let's go a little deeper about the pressures that we were just talking through. And let's try to, can you compare what's happening today to what happened a few years ago and provide insight on why you think that's happening?
So the picture that happened after COVID or during COVID was that hospital finances turned upside down. And labor costs soared, drug prices soared, supplies, equipment, everything cost more money. And that was something that kind of took the industry by surprise, and we are also dealing with the pandemic. So coming out of the pandemic, hospitals have not had, overall, I would say statewide, we are continuing to operate at negative operating margins. So that is a challenge. Every time that you deliver care and you're losing money, that is not a sustainable proposition. Now, we've got hospitals, rural hospitals, some that are doing okay. We've got some that are not doing okay, and same with the urbans. Although I would say the urbans and the health systems predominantly continue to have negative operating margins. And the drive of that, as I said, are those factors. And the ability for hospitals to control those are limited. But hospitals have been working on efficiencies, eliminating administrative positions, ensuring that, trying to preserve the access to care that exists in the communities. However, what's happening is that those losses are continuing, and we're going to be met with state and federal cuts in taxes that are going to drive those losses further. And at some point, the math does not work out. You cannot keep having those losses without the impacts to patient access. And that's what we're seeing. That's what we're seeing, the headlines of closures of certain services in hospitals, layoffs of staff. And that's not where we want to be, and those are heart-wrenching decisions for people.
Yeah, I think Chelene's absolutely right. There's just confluence of factors that have all converged pretty much concurrently in the last 5 years that they all existed 5 to 8 or more years ago, but they've materialized in more significant ways. And certainly, they show up in all sorts of different forms. I mean, there's a labor shortage. There's increased morbidity in society. So there's just more demand for services. So those two things alone are going to create some tension. There is new costs coming online at, I would say, unprecedented way in the form of like drug costs, as an example. And there's just other factors like technology that are impacting the industry writ large. So in some respects, they thrust us into this period of transition. And so Chelene used the word crossroads. We're in that mix. It's where the river meets the ocean. It's going to swirl for a bit, and we're working through it. Add to that the fiscal pressures that have come from government, and there's no doubt that there's a major impact of H.R. 1 on the Medicaid population, but that spills over into the private sector too. And employers and consumers who are buying in the private marketplace are feeling those effects as well. And those things didn't exist in maybe the same way that were present 5 or 8 years ago.
Yes, and who knows, it could probably get a little worse, right, as things continue. And that's why collaboration between organizations like plans and providers is going to be critical to get us through this. Let's go a little deeper on what you just brought up, Jeff. One thing that comes out of all the decisions that are made in Medicaid, Medicare, ACA, is that the whole system will be impacted. Can you talk a little bit about your perspective on why that is, and maybe potentially solutions to get us through that?
Well, it's one system, not many systems. And by that I mean public or private sector, large or small business, group or individual. They're all interconnected. So to the extent there's a change made at one level or in one place, it's going to spill over to the other. That's true for federal government and state government. I mean, we see that playing out in Medicaid right now. And we'll see that even manifest further going forward with changes coming to hospital reimbursement for state employees. That the costs that are borne by those facilities to care for those individuals may be lower, or the reimbursement will be lower, but the costs will not change, and in fact will need to be subsidized in another way. So it's the balloon, and we're squeezing the balloon and just pushing those costs onto other contributors to the system. So that's why, one of these changes, and I would say something that I've observed for decades now. I started my career in Washington, D.C., working on Capitol Hill. And I look at, we have a lot from government here today and policymakers and regulators and stuff. And the one thing I would say is we just have to look at the system as a whole when we're deciding we want to modify one of those pieces, because the system's perfectly designed to produce the outcome it produces. But we can all accept today that the outcome we're getting is not the one we want. Therefore, you've got to redesign that system, and you can't do it. It's hard to do it wholesale, but you can't do it in isolation on a piecemeal basis. And the example I gave about the reimbursement for public employee care is an example of that. There is going to be spillover. So collaboration, back to the theme of the conference, requires us all to kind of step back, lower our self-interest, and be courageous in the sorts of initiatives we'll pursue, which may entail some sacrifice, frankly, even among the private payers, but for those on the healthcare delivery side as well, and government too. Like, we have to look at this holistically. If we don't do something like that, and in ways that are best for the whole and not for the self, if we don't do that, we're going to find ourselves in this same situation year after year.
The provider perspective?
Yeah, so I think that when we look at the choices that we're making in Washington State, having the affordability lens on every single one of those choices is really important. Hospitals, speaking, from that perspective, there's a lot of issues in society where there's the fabric of supports break down, and people end up using the emergency department as a place for to go when they're lonely, to get a meal, to when they can't get into their primary care provider. I mean, there's a lot of different pieces that drive utilization and the challenge within affordability in that lens. And I think that when we step back in the policy landscape, thinking about, are those the policy decision, we believe it's the right one, but what is it going to do to the cost of the system? And we can't keep making choices that are driving up costs and expect that providers are going to be able to absorb those. And that's, I think, a bit of that crossroads that we're at and what we're seeing in Olympia and others. I think it's an opportunity. I think it's an opportunity for us to talk differently, because hospitals will be unable to solve when the social safety net starts to erode. We are unable to absorb that, and that's what we're hearing from our members. And the concern is real. Like, other countries invest a lot more in social services. They don't have some of these challenges that we do, and yet we kind of keep doing the same thing expecting a different result.
Jeff, do you want to react to that?
Well, I fully agree with it. I would add two other stakeholders, minimally two, to the list that have to be considered. To the extent there's a policy change that drives cost into the system, it shouldn't be it isn't just borne by providers or the delivery system. It is also borne by payers and business. And I would contend that right now the state's in a very perilous place with regard to the appeal for business to continue here. I also chair the Washington Roundtable, which is comprised of 50 or 60 large businesses in the state. And some of the actions that have been taken and are being considered today are very problematic for business. And they are a necessary part of our community and our economy and the healthcare system. And to the extent they're pressured in their ability to conduct their business, it's going to spill over into other parts of our society, and healthcare is one of those.
So I'm a big solutions person. In these discussions that you're having at the roundtable, what solutions are being offered?
Well, around healthcare specifically, we're not talking as much about that. The two areas that the roundtable focuses on primarily are around education, so getting the workforce to ensure that we have the labor supply to do the work necessary to fuel the economy. And the other is around fiscal policy, largely, and how the state's prioritizing its spending. You know, the state budget's doubled in the last 10 years, and the appetite for more spending continues to be high. We see that reflected in some of the proposals now that will be considered in Olympia, and those are problematic. That's not to say that there are aspects of the tax structure in this state that don't warrant some refinement minimally. The roundtable would agree with that, but there are also concerns about how far you go in trying to resolve issues, at least as perceived by some, that have major consequence.
Anything that Jeff missed that the Hospital Association would like to help him be equipped with as he goes into these conversations?
I'm not sure if Jeff would agree with the Hospital Association's legislative agenda and all of the ways that we're thinking about the 2026 session, but I think a couple of the areas that we could and would agree on are, you know, the do no harm. I think that we are definitely in that boat here of there's a lot of goals, there's a lot of individuals who are really trying to do the right thing, but again, stepping back and thinking about, is this the right time to do this? Is it adding value? Is it, at the end of the day, really helping patients? Because I can name several examples of all of the different issues that hospitals are managing that, you know, it was a great idea at the time. Yes, reporting daily COVID cases, that was a good thing at that time. And yet hospitals are continuing to do that on a manual basis because we haven't adjusted regulations. So I think we've got an opportunity. I think we've got a hard conversation ahead of us, and that's, I think, why many of us stay in healthcare, is that it's always interesting, it's always different. We always have new problems to tackle, but some of these problems actually need to get tackled. We need to remove some of these barriers, some of these layers of regulation and cost, and that's always easier said than done. But we actually went through and produced a whole list of costs that are added to the system that hospitals are dealing with, and I'm sure that we could all do that at the end of the day of like what's not adding value anymore. So I think that what I would add is, you know, how else can we think about that when we're in a time that we don't have a lot of state resources to invest in new priorities, which is a big shift from where we were at.
Yeah, can I just add to that? I mean, you in your question were seeking solutions, and it is very easy to just kind of dance around the problem. We can all see it and describe it, at least from our vantage. The solutions are a little more abstract or not as obvious. But, you know, the Blue Cross Blue Shield Association's done a lot of analysis on opportunities for improvement in healthcare. And there's an affordability study that shows there's $1 trillion in savings over 10 years. There are certain things that need to happen for that to occur. You know, a part of it is around drug pricing and some of the tactics that are employed to actually delay biosimilars, for instance, coming to market, patent thickets, pay for delay, exclusivity provisions. You know, if we were to address those sorts of things, and politically, I know that's really difficult, but there's $100 billion sitting right there. Site of care, neutrality on site of care around Medicare. There's $480 billion in savings if we just pay for this same service no matter where it's delivered. And I realize there's some practicalities and realities on the delivery system side, but the fact is it's the same service. And the consumer should not pay more simply because it's done in a different location. So there are a lot of opportunities out there for us to get better, but the will and the alignment
And I
are
think
hard
actually
to find.
the understanding of the problem and how to solve it is sometimes not there. I've worked in this industry close to 30 years, and I think two of the biggest constituents are represented right here of not knowing how the other necessarily operate, their businesses, right? Mm-hmm. So let's go a little deeper on that and just get each of your perspectives. When health plans talk about affordability, it was as Jeff had described, right? And a lot of the things that you mentioned, we might not have, or the hospital might not have control of those, right? And it's kind of outside of the hospital. Chelene, how do you define affordability from a provider perspective?
So I think affordability means different things to different people, as you just described. Jeff's comment earlier about the site-neutral payment policy, I would say that that's going to make healthcare less affordable, because when you cut hospitals that are getting paid that payment that Jeff just described, that is going to have to go somewhere. Either you're going to reduce services or you're going to ask commercial insurers to pay more. So that, I think, is the disconnect between payers and providers often, is that what Jeff would find would drive savings or affordability is exactly the opposite of how it's going to impact providers at the end of the day. And there's a rationale for paying a differential, and if Medicaid access is a huge deal in our state. We've done a tremendous job of getting people covered, and I'm really hoping we can keep as many people covered. But Medicaid does not pay the cost of care. And many independent practices, I know Premera is not in the Medicaid market. That is a different line of business, and we are subsidizing Medicaid across the country from commercial payers, and that drives affordability in different ways. So affordability, I think at the end of the day, you need to think about it from, is it affordable to deliver it for the providers? Is it affordable for the consumers? We always want to keep that in mind. But there's a lot of different layers that drive cost increases and make things less affordable at the end of the day. That, again, keeping that eye on that prize.
Yeah, I fully appreciate that. That's, in fact, why these panels are so powerful.
Exactly.
Because the dialogue is so critical. I mean, we enter every discussion at Premera with an attempt to understand with empathy. And unless you know the other side, you know their issues and you know their perspectives, or in this case, the business models, it's very hard to find common ground that will solve problems. And so it's important for us to talk about these kinds of things. When I think about affordability, I offered one solution there, but there are some things that are really driving costs here. And I was looking at a chart the other day that resulted from a study in DC, and it showed that from the period 2000 to 2022, wages had gone up basically 90%. So pretty good. Medical services had gone up 130%, and hospital prices had gone up 220%. So essentially, they had more than doubled what the earning power was of individuals. And you look at that and you say, okay, that's unsustainable. And we have the great privilege at Premera of serving, wonderful companies, large and small, including some global icons that are based here. And the fact is, they're seeking solutions. Like, you can't just say, hey, I've got to raise your rates because. They say, it's unsustainable for me to continue to pay what I am. What's the answer? And that forces us to go find an answer. And that sort of pressure and transparency is not universal in healthcare, in my view, and as such insulates some from some of those realities.
Also, solutions like value-based care, where you focus on quality and outcomes rather than, fee-for-service, right? All right, so
Dar, can I
Yes, please.
follow up on that too? Because it's interesting when you think about what hospitals are ultimately delivering, right? It's care to people that are in the hospital or in the clinic. And I'm looking at this monitor that has this lovely picture of Seattle here in front of me. And the cost of that TV has gone down significantly over time, right? And we think about, oh yeah, that's good. And what has gone into that is, automation and less labor costs. And I think that is where hospitals are different in this situation, is that you look at 60 to 70% of hospital costs are labor. We're not talking about eliminating, or how are we going to make that, widget less expensive. We are a labor-driven market. And when you look at how inflation impacts industries like that, it's very different than manufacturing or others. And I think we also get in our own way. Like, hospitals are moving to electronic scheduling, which, who wants to really call somebody up and make an appointment anymore? You want to be able to put your information in, get your appointment booked, and be done, right? And there's rules and regulations that are looking at impeding hospitals' ability to do that. So even when we are trying to reduce costs, there's something that kind of gets in the way, because it's like you said, a complex system with a lot of different players. So I don't know. I go back to the TV. We're not going to be the TV. I mean,
Well, there's a lot of truth to that, because technology does lower costs in most industries, but it's not been the case in healthcare. I mean, you look at some of the incredible cures that have come online. Lameldi, which is for cures a fatal nervous system issue in children. It's $4.5 million. I mean,
well, sickle cell.
Yeah,
there's a new drug for that is going to be administered inpatient. Talk about it. I mean, it's a great. I mean, that's groundbreaking, life-changing, and how much money is it going to be?
Expensive.
Yeah.
So I, like Jeff, am an optimist. So despite all these challenges, hope is always something I kind of, hold top of mind. What gives you hope about the direction of Washington's healthcare system? Jeff, we'll start with you.
Glad she called on Jeff there.
Yeah. Well, as I said, it's my nature to be optimistic about things. And I started my comments by commending everybody for being here, because that gives me hope. I think that we are at a really critical point, and sometimes crisis forces action that would not otherwise happen. And I'm hopeful that collectively we can come together to find solutions to that. That said, I'm concerned that it's going to get worse before it gets better. A, because of the chaos at the federal level. B, the pressures at the state level. Maybe some of the ambition that exists in state government too, around spending. I think that's going to really pressure our state and thus our healthcare system. Maybe the other thing that gives me a lot of hope is the promise of technology. I really do think that that's going to be a game changer for society. I think it's concerning in some respects how dramatic those changes will be, but I'm also encouraged by the benefits that it'll bring too. But this is, I mean, we shouldn't kid ourselves. It's a steep climb, and it's not going to get any easier.
So Dara, I'm a realist, so this question is very difficult for me.
I'm sure. Yeah.
I do think we have a lot of very smart, talented people in healthcare, and I am hopeful that we can come together around common ground, and that is genuine. I do think we have some really challenging issues, and I agree with Jeff that it is going to get worse before it gets better. So that I think why it's a little bit hard to answer the question honestly in terms of like what really brings me hope. So I'll look to my children that keep me busy, and I survived getting on a chairlift with my 5-year-old with him clinging to the bar and off of it. So we can do hard things. That gives me hope.
Exactly. And not to mention this morning, we heard from our state agencies that they are collaborating amongst themselves in a totally different way. A lot of new faces around here in Washington. And, that is really what I hope for. That provides me hope, those individuals. No pressure.
Yeah.
On
And
you
how
guys.
can we do things differently? Yeah.
Yeah,
Right.
I mean, in some respects, we've been painted as being on opposite sides of things, but in fact, we're not.
It's true.
We're a part of the same system. We're at least for the same kinds of things, which is a better Washington, a better community, better health for all. And I have tremendous respect for many leaders on the delivery system side. I mean, Atori among them. I think that Evergreen is a remarkable organization, and I really admire the way in which it engages, the spirit that it brings to that. And he's not alone. There are others. So it gives me hope that we can sit down, we can do so in a trusting way. Again, just back to the technology side of things, I think that gives us an opportunity to share information, data, to integrate administratively in ways that will benefit both sides. Take prior authorization or something. Like we continue to streamline that. 16% of ours are real-time, adjudicated and approved. Let's continue that. And to the extent we can remove some of those points of friction, that's going to make things better, and hopefully, and by better, not just administratively so, but from an affordability standpoint.
And Jeff, actually, you're a regional local plan, which your commitment to this community is obvious, right? And so you're different than other health insurance companies.
Well, we like to think so. Thank you for noting that. There are other great companies that are on the payer side too, and I respect them. I do think our investment in this community is unique, and our presence is deep and strong, and we're going to continue to build on that. And we're in this for the long run. This is not a transactional business for us. We need to work with the hospital association or with Atori or with whomever, with our leaders in state government to make it better for the whole.
So we have about a minute left. I would ask each of you to spend 30 seconds talking about how you'd like to wrap up this conversation for all of these people to walk away from this discussion.
Well, one of the things that we talked about last night was the ability and the willingness to hang in there on tough conversations. I liked what Jeff said around understanding what drives, in this case, the business model. But the business model is caring for patients at the end of the day. The mission of the hospitals is to be there for the communities 24/7, 365, and save lives. So there's going to be differences, but I think understanding where we are coming from and figuring out, is there a way to work together? We try to have that spirit going into the state legislative session. We know that we have to say no to certain things, or that's not a policy that we support. But at the end of the day, we're at the table, and I hope that that will continue for our state.
One word would kind of wrap things for me, and that's perspective. And I say that with regard to time. Like, you're not going to solve it in the short run, so let's think long term. And the other perspective is yours, not just mine. And in lowering your own drive for your objectives and looking at the whole instead.
So thanks to both of you for listening to what the other has to say. Appreciate that.
Modeling.
Thank you.
Thanks, everybody.